My name's Louise Bamford. I'm here with Chris Hyde. Sorry, Chris. We are clinical practice educators, and we're here with Charlotte to do the primary secondary survey. Charlotte, can you introduce yourself for me, please?
I'm Charlotte Hearing.
Pin number?
54226.
Okay. So this is part of component 15 of your apprenticeship programme. Are you happy? You've had enough time to practice?
Yes.
Okay, so you are attending a 45-year-old male who has been found unresponsive. The person who's found him doesn't know him well enough to give you any history. So whenever you're ready, you take it.
Okay. I am donning my appropriate PPE. As I'm approaching the patient, I am checking for danger, making sure that it's safe to approach, looking for any slips, trips, falls, hazards, anything that could affect me and my patient. I am looking for any environmental factors, drug paraphernalia, anything that could indicate what is going on, and there is none. I am going to check for catastrophic hemorrhage, position, colour, work of breathing of the patient. They are led down, colour is fine. Yes.
Colour's fine, sorry, yeah.
Yeah, and I'm going to try and alert my patient now as I approach. Hello, can you hear me?
No response.
I'm going to use a trapezial squeeze just to
No
try
response.
once again. No response at this point. I'm going to call for the paramedic backup. I'm going to make my way over to the head, and I am going to look in the airway for any obstruction.
And you can't see anything.
I am then going to just do a C-spine feel and feel for any bumps,
No
lumps.
concerns.
And then I'm going to do a head tilt chin lift, and then I'm going to look, listen and feel for no more than 10 seconds. Make sure there's rise and fall of the chest, which there is. I'm going to now manage my airway with my patient. I'm feeling at the carotid. Listen and feel at the carotid. I'm now going to insert an OPA measuring from the side of the mouth to the bottom of the earlobe. I'm going to invert, insert, rotate and locate. Then using the MPA I'm going to do the exact same thing, measuring, make sure the bevel is facing the inside of the nose, make sure to feel for any resistance if there is any. I would use some lubricant. Now that my airway is managed, I am going to do some observations. So, I am going to do a SATS probe.
And you have SATs of 97.
I'm just going to feel the chest, make sure that there's equal rise and fall.
And there is equal rise and fall.
Okay, and now I'm going to listen at the chest. Just going to expose them slightly. Okay.
And it's clear, equal air entry.
Lovely. Now we're going to move on and do blood pressure.
And you have a blood pressure at 120 over 80.
I'm just going to feel for the bilateral pulses.
And you've got bilateral strong bounding pulses around the 80 mark.
Okay. I'm going to quickly just do a temperature.
36.2.
And a BM.
BM of 5.2.
Okay, so now I am just going to do a pupil look, and I'm making sure that they're equal and reactive.
And they are equal and reactive size 4.
Size 4, so I'm going to work out a GCS of 3. I'm going to do a capillary cap refill.
Your cap refill time is below 2.
Okay, so now moving on, I am going to feel around the head, checking the airways still maintained, is in central with the chest, and then I'm going to move on and feel the chest and the back, see if I can feel any lumps and bruises, which I can't. Moving down onto the chest, I'm just going to expose them, initially to try and keep the dignity. I'm going to have a feel around the chest and then moving on to the abdomen. I am looking for any bruising, any anything visible, and then I am going to do a somatic palpation on the abdomen, and then I'm going to do a visceral as well on the abdomen, which I'm feeling for any lumps, rigidness, anything abnormal. I'm now going to listen to the bowels as well, see if I can hear anything.
And you hear some gurgling.
Okay, just going to try and cover back up. Moving down onto the pelvis, I'm going to look for any incontinence, priapism, anything that could indicate a lower C spine injury. And then I'm going to feel around the pelvis, making sure it's in line. Back of my hand to feel the front, if the incontinence or anything isn't visible. And then I'm going to move down onto the legs. Same thing, feeling down the sides of the legs, making sure that there's no lumps or bumps, my hands aren't wet, feeling for any blood, and on the inside of the legs as well. Moving down to the feet, I am going to check for any trap marks, any medical bracelets, and I'm going to do a capillary refill and a pedal pulse, marking with an X in the time. And then,
you have a pedal pulse.
lovely. And then I'm going to do the same on the other foot, capillary refill, trap marks, and pedal pulse. Moving back up to the head, I'm going to check the airway again, making sure that we're maintaining it. And then I'm going to feel the arms, make sure to feel for any blood loss, any bumps, any broken bones. And same with the other arm on that side.
Yeah, my name's Louise. Can you tell me what we've got?
We've got a 45-year-old male found unconscious, no bystanders, no one really to tell us anything that's been going on with them. They've been maintaining their airway, sats at 97. They've got a good BP, good temperature, no obvious signs of trauma. We could do with putting them in the recovery position and looking at bruising on the back, and request ECG in a blue light hospital. That's
Lovely.
okay.
And how are we going to get them out to the hospital?
I think the best option would be a scoop.
Great stuff, thank you. So you mentioned the blood pressure was okay. If the blood pressure had been 80 over 60, what could you have done to help manage that?
We could have elevated the legs.
Yeah, and what could I do? What could a paramedic give?
With fluids.
Yeah, lovely.
Yeah.
So if we now imagine, in fact we'll talk about reassessment for now. So you were reassessing the airway when I came in there. What are you reassessing for each time you look?
Make sure they're maintaining it, make sure that they're not bringing anything up, nothing's obstructing it, and they can breathe fine.
Okay, so you manage any deteriorations. Yeah. Marvellous. So each patient comes, well, they're covered by legislation.
Yes.
Can you tell me what legislation they're all covered by?
We've got the Human Rights Act, we've got the Equality Act, the Mental Health and the Mental Capacity Act.
Marvellous. And which patients might you have to adapt your approach to?
We've got paediatrics, bariatrics, dementia, learning disabilities and pregnant women.
Lovely, thank you. So now we'll imagine this patient's conscious. You find a tachycardia at 120. What could you do to help manage that?
Try and calm them down, breathing techniques, just talking them through it, explain what's going on while you're there.
Okay. And if they were in any kind of pain, what could you help?
Use a pain score, give them pain relief.
And if they were, what kind of pain scoring tools are you aware of?
You've got the Socrates pain score, you've got 1 to 10, and then for children you've got the smiley face one as well.
And are you aware of the one that we tend to use with people with either dementia or learning difficulties?
Is it the ladder one?
There is the ladder, but there's the other one as well. It's got a girl's name.
Abby.
That's the one. And then you know your sample. You've told us in numerous other OSCEs. Can you just talk me through what it means? You can write it down if you want, if it's not off.
I don't know if I actually know it off the top of my head. Sample.
You can write it down on here.
Did I?
And I'll let me get you another pen.
SC
The history, yeah, the history taking.
taking. So is it scene, situation?
No. So what are you looking for, or what might the patient feel that might indicate what's wrong with the person?
Signs and symptoms.
Okay, yeah.
So signs and symptoms. It's not allergies.
Allergies, yeah.
Right, I'm really
You're in there
yeah,
now, you're in the
signs
zone.
and symptoms, allergies, medication or medical
Absolutely,
history.
yeah.
Past, is it pain?
That's medical
Past
history, yeah, you
medical
just said
history,
that, yeah.
last food intake
Yeah.
and evaluation.
Or what might have happened beforehand. The events leading up to
Oh,
it.
events.
Yeah.
Right.
You've used it twice in others.
Yeah, no, yeah.
Right, I'm going to pass you to Chris now, because no doubt I've definitely missed the news score, but I don't know what else I've missed.
So why do we constantly need to repeat our odds and reassess our patient?
They could deteriorate at any point, checking and making sure that everything that you're doing isn't changing the course of events, so constantly checking airways, observations and everything to make sure that what I'm doing is helping them and not deteriorating them.
And if they start to deteriorate, what does that enable us to do?
Look at different ways of helping them. So finding the cause of what's going on, if possible.
Yeah. So it allows us to
Redirect,
tailor our care,
yeah.
redirect our care and channel it in the right way. So,
Yeah.
So the rapid primary survey, how long should that take roughly?
Between 60 and 90 seconds.
And I know that you've mentioned MOI, but what does it stand for?
Mechanism of injury.
Okay, so can you get your phone out for your news 2 charts?
Yes. Okay.
And we're looking at a healthy adult who scores 0 in their parameters. So can you tell me the respiratory rate of somebody who's got a news score of 0?
Between 12 and 20.
And their oxygen saturation is SpO2?
Between 94 and 98.
What does your news 2 say there?
It's that arrow and
On
96.
0 score.
Yeah. So what is it? Anything above 96?
Yeah.
Don't get them arrows.
And the type 2 respiratory failure?
88 to 92 on air.
Systolic blood pressure?
111 to 219.
And the pulse?
51 to 90.
And on the AVPU scale, what would the charts have there?
Alert.
Thank you. And lastly, temperature-wise?
36.1 to 38.
So if our patient had a temperature of 37.5 or above, what kind of things are we thinking? What are we considering?
Potential infection and pain possibly as well.
Okay. Let me just see if we've got anything else there. No, that is everything.
You might have said it and I might have just missed it, but what kind of things were you looking for on the wrist and on the...
Medical bracelets.
Lovely. And you mentioned somatic and visceral when you were doing your abdomen.
Yeah.
What's the somatic one looking at?
Somatic is you're looking for any obvious signs of lumps or anything like that that you can feel gently, and then visceral you're kind of going a bit deeper to try and feel if there's anything a bit further that you can feel.
Thank you very much. That's all the questions from me.
Yeah.
Happy?
Yeah, absolutely.
Well done. Thank you very much. Now you've passed, we'll give you some feedback.
Okay.